Are doxycycline side effects common? Doxycycline is a commonly prescribed antibiotic used to treat various bacterial infections. Like any medication, doxycycline can have side effects. However, it is important to note that the frequency and severity of these side effects can vary from person to person. In general, doxycycline is well tolerated and most people experience only mild side effects, if any. Common side effects may include nausea, vomiting, diarrhea, and abdominal pain. These symptoms are usually temporary and resolve on their own as the body adjusts to the medication. Less common side effects of doxycycline may include skin reactions such as rash or itching, sensitivity to sunlight, and yeast infections in women. These side effects are typically mild and not cause for concern. However, if they persist or worsen, it is important to consult a healthcare professional. Rare but potentially serious side effects of doxycycline can occur, although they are very uncommon. These may include severe allergic reactions, liver damage, and a rare condition called pseudotumor cerebri, which causes increased pressure inside the skull. It is important to seek immediate medical attention if any of these serious side effects occur. While doxycycline side effects can occur, it is essential to weigh the potential risks against the benefits of taking the medication. If you have any concerns about the side effects of doxycycline, it is always best to discuss them with your healthcare provider. They can provide you with personalized advice and guidance based on your specific medical history and condition. Remember, this information is not exhaustive, and it is always important to read the medication's package insert or consult a healthcare professional for comprehensive information about doxycycline and its potential side effects.